Can sleep apnea cause twitching? If you've been experiencing twitching or jerking movements during sleep and are wondering if it could be related to sleep apnea, you're not alone. Let's break down the connection between these two conditions. Sleep apnea is a breathing disorder that causes repeated pauses in breathing during sleep. There are two main types: obstructive sleep apnea, OSA, and central sleep apnea, CSA. In OSA, the airway narrows or closes, while in CSA, the brain fails to send the right signals to the breathing muscles. Now let's talk about twitching. Twitching or jerking movements during sleep can be caused by various factors, including sleep disorders. However, sleep apnea itself is not typically associated with twitching as a primary symptom. The twitching you might experience could be related to other sleep-related movement disorders. For instance, myoclonic jerks are a type of movement that can occur during sleep, especially in the REM stage. These jerks are often benign but can be frequent enough to disrupt sleep and cause non-restorative sleep, neck pain, and stiffness. In the case of sleep apnea, the primary symptoms include loud snoring, pauses in breathing, daytime sleepiness, and morning headaches. While sleep apnea can lead to restless sleep and movements, these are generally due to the body's response to breathing disruptions rather than twitching or jerking movements. If you're experiencing twitching and suspect it might be related to sleep apnea, it's crucial to look for other signs of sleep apnea. These include excessive daytime sleepiness, loud snoring punctuated by pauses in breathing, and frequent awakenings during the night. However, twitching itself is not a direct symptom of sleep apnea. To determine the cause of your twitching, a sleep study such as a polysomnogram, PSG, might be necessary. This test can help identify if your twitching is due to a primary sleep-related movement disorder or if it's associated with other underlying conditions. In summary, while sleep apnea can cause restless sleep and various other symptoms, twitching or jerking movements are not typically a direct result of sleep apnea. If you're concerned about twitching during sleep, it's best to consult with a healthcare professional to determine the underlying cause.